Basically, this is what you need to know. A ligament is fibrous tissue that spans between one bone and another. All right, these almost always are over joint areas, and these are areas when there is hyperextension of that particular joint, in this case an ankle, that ligament can be injured. If that ligament is torn, it is referred to as a sprain. Now, there are also muscles and tendons. A tendon is the fibrous insertion, the fibrous end of a muscle, which inserts into bone area. And this is, for example, a tendon right here. And when a tendon is torn, it's referred to as a strain. Now, most sprains will occur over joint areas, ankles, wrists, fingers, neck, things like that. Strains most commonly occur where you have large muscle groups. So back strains are the most common area that you'll find these. Basically, you need the integrity of all of these in order to have normal support, strength, and locomotion. This is your Achilles tendon. Otherwise, basically a tendon goes from the heel all the way up to the lower leg, and when it is torn, when a tendon is torn, it is referred to as being ruptured. Now, these are typical appearance of sprains, and almost all of you have had a sprain sometime in your life, and it's very simple. Usually you'll see some swelling, you'll see some bruising, and of course there'll be significant pain. So here's your sprained finger, a sprained wrist, a sprained ankle. Now, the way to treat sprains is very simple. Just use the terminology, the acronym RICES. Okay, basically that stands for rest. Basically what you want to do is you want to stop doing whatever you're doing that caused you to sprain your ankle, for example, in this particular case. And if you don't rest an injured area, it will never heal. Of course, you're going to want to place ice on that area. Ice will help reduce the swelling that occurs from the injury. And this you should do for about 20, 30 minutes at a time, and you should do it several times a day. Each time followed by compression. In other words, take an ACE wrap or something like that, and always start beyond the level of the injury, and you will end up several inches above the level of the sprain itself. And this is meant to help prevent swelling as well, and to help give support to the injured area while it is healing. Sprains in extremities should be elevated above the level of the heart if at all possible. This will allow more drainage of inflammatory fluid back to the body core, where it will be absorbed and processed. And of course, you want to stabilize. Now, you can stabilize the injury simply with a compression stocking, a compression wrap. And by the way, to make sure you don't over tighten these. If these are too tight, then you'll see some changes in coloration or numbness or pins and needle sensation beyond the level of the tightening, beyond the level of the wrap. And if that happens, you must loosen it. And you're going to be putting this on and off frequently, because you're going to be using it with the ice packs, and you're alternating it to give support. So this stabilization, you might get away with just doing an ACE wrap, but sometimes a splint of some sort would be useful. Yes?
If you had to choose between ice or elevation, which would it be?
I wouldn't choose between them. You should do both. Yeah, but
what if there's no?
I don't see a situation.
What if there's no ice, like you're out in the woods?
And then you don't have a choice. I would elevate and compress.
But there's like creek water and stuff, like creeks and rivers. You can cool it down.
I can't hear you. I'm so sorry.
Stream water. Streams.
Oh, if there's stream water, yeah, that's cold, and that will be better than nothing.
That would be down, not elevated.
And put it in the stream with cold water for 10 or 15 minutes, then wrap it and elevate it. Yes, absolutely. That's a good point, because you may be in a situation where you do not have the ability to make ice. So yes, it makes a lot of sense. Now, by the way, there are a lot of, each individual sprain is wrapped slightly differently. And so you might consider going to this website, which I have no relation to, but I think is an excellent website with regards to finding out how to wrap each and every one of these individual injuries. It's called expeditiondoc.com. All right. Well, of course, now we've talked about sprains. Let's talk a little bit about strains. Of course, strains mostly occur from back issues, and a little common sense would probably go a long way to preventing most strains. You should always, before you do anything strenuous, stretch out. Do stretching exercises before you run or before you are expecting to do some heavy lifting. That would be a good idea. Of course, you lift with your legs, not your back. I'm sure you all heard this stuff. Your object should always be right.
Okay, when you're lifting something heavy, make sure that you squat down with your legs, you grab the heavy item, get it close to your body, and then you're gonna lift with your legs, okay? Do not do this, pick up something, and straighten up, because you're going to hurt your back. It's like all of us probably have, and doing it quickly, not thinking. That's nursing 101, by the way. Squat and lift.
So make sure you don't, and so just be sure that you're never reaching for something, that you have the item that you're lifting as close to you as possible. Of course, if you're backpacking, make sure you have a good hip support that puts most of the weight on your hips and not on the back muscles. And of course, if you're on a regular terrain, consider the use of a walking stick. All right, let's talk about this. How can you tell the difference between a sprain and a fracture? All right. What do you think this is? Fracture? How about this? Look like a fracture to you? How about this? That is a fracture also. Doesn't it look just like, pretty much just like the sprain I just showed you? How about this? That's a fracture also. So basically, it's easy sometimes to identify a fracture, and sometimes it's actually very hard. And even trained radiologists need the use of your typical X-ray equipment, CAT scans, MRIs, to really identify this at one point or another. So how can you tell the difference between a sprain and a fracture? Well, there are several ways that you can identify this. Now, let's say with a sprained ankle, usually it's going to be painful to walk on, but with some assistance, you probably can put some weight on it to get where you have to go. If you actually have broken your ankle, you would be a pretty sturdy individual to be able to use that bone at all. So there's a difference in the quantity of pain that you'll see in someone with a sprain versus a strain. You'll see more pronounced swelling and bruising. Interestingly enough, if you rub your hand along the bone that is, or joint that is injured, you may notice a grinding or a grating sensation as you move your hand along it. Now, another thing that's a sign of a likely injury that's a fracture would be a deep cut in the area of the injury. This is a certain type of fracture called an open fracture. We'll talk about it in a second. And of course, motion of the bone in an area where there is no joint is a sign of a fracture. In other words, if your index finger has 5 knuckles, you probably broke it. There are various types of fractures, and you could learn all the individual types, but really there's only, for our purposes, there are 2 things that we need to know about fractures, and whether they are closed fractures or whether they're open fractures. In a closed fracture, you could just have a simple snap. It could shatter, it could cave in on itself, or it could have a green fracture, but the skin is not broken. Therefore, remember how Amy talked about the skin being your natural armor? Well, guess what? Your natural armor is still intact even though there's significant damage here. Here there's significant damage, but the bone has actually gone through the skin. It may still be sticking out of the skin when you look at it, but it might not be. It might have come inside. But this is an open fracture. Now, with an open fracture, you will have taken some of the natural bacteria that lives on your skin, and you will have now put it all the way down to where your bone marrow is. And when that happens, you can develop, number one, it goes into your blood vessels, which causes a severe infection known as sepsis, and it goes into the bone vessels, the vessels in the bone, the periosteum, the lining of the bone, and things like that, and causes a bone infection, which is called osteomyelitis, which is very, very difficult to heal from, even under the best of circumstances. So there's a big difference between a closed fracture and an open fracture in terms of how well people are going to do afterwards. And so you must know how to identify these things and treat them. This is an open fracture. This is an open fracture. They're very different in degree, aren't they? However, each one of these has broken that armor, has allowed bacteria to enter and go into blood vessels and go into the bone itself. And so both of these they're different in degree, but they each carry a similar risk of infection that could be life-threatening. Now, to evaluate the injury, when you see somebody that may have a musculoskeletal injury, you want to cut away a serious musculoskeletal injury. You want to cut away any clothing over the injury. Now, why would you want to take your bandage scissors, which is compulsory, by the way? You better have one of these, and you should get one at least that's at least 7 inches, and it should be made all of metal, because we just we're testing a few of them. The ones with the plastic handles, we actually tried to, we doubled over a pair of jeans like that, and they actually snapped. They actually broke. So make sure you get an all-metal set of bandage scissors, and you're going to use that to cut away clothing over the injury so that you can properly evaluate it. Why don't you want somebody who looks like they've broken their hand or arm to remove their shirt themselves? Because they could injure themselves more. And so you want to do this for them. You want to check, one of the first things you want to do is check and see if there's an open wound. Do they have an open fracture, or do they have a closed fracture? You want to control any bleeding that they have from the wound, and we're going to be talking about that very soon. And you want to check for sensation beyond the area of the injury. When you break a bone, there are all sorts of things that run right alongside it. They, of course, blood vessels causing bleeding. Nerves run right alongside the blood vessels, run right alongside the bone, and they can be injured also, and you can lose sensation, so you must test. So actually a safety pin is actually a useful item to have in your medical stores, not just so you can tie off a sling, or put a pin on a sling, but also so you can identify whether someone has suffered a nerve injury along with the trauma or the other trauma they've experienced. And you want to check for pulses beyond the area of the injury as well, because you want to make sure that the circulation hasn't been disrupted beyond the level of the fracture. Now, this is what I want you to do. We're going to identify, I'm going to teach you how to identify bad circulation. Take your hand, pinch your middle finger. I want you to look at your middle finger as you're doing it. Release quickly. It's white. It's red again. It's pink again, right? All right? That has to happen within 2 seconds. Did it happen within 2 seconds? That change back from white to red? Oh, congratulations, you all have normal circulation in your finger. Awesome. All right? But not everybody does. Here's somebody who obviously, didn't just do that, yet they have white fingertips. Here's someone who has bluish fingertips. Both of these are signs of lack of oxygen in circulation. And so this is something that you have to look for and identify. If this exists, you've got a more severe injury than you thought. Now, correcting the fracture. Of course, anytime you have an open wound, you have to irrigate it. When I say irrigate, I mean you take either a dilute solution of iodine povidone or betadine solution. You take some salt water solution, or you even take just sterilized water and you wash it thoroughly out, get all the debris out, get all the blood clots out, do the best you can to get that as clean as possible. Then, if the bone happens to be deformed, it would be awesome if whatever fracture it is did not deform the bone, but many times, as you saw in the images I put up before, that many times it is deformed. Then you have to reduce the deformity, which means that you have to align the bone. Okay, all right. Basically, this is something that's best done with two people, but what you would do, here, you do it on me. Okay, let's say I broke my upper arm, okay? What you want is you want someone to support this side of the break. Then what you'll have to do is you have to, with steady traction, you have to actually straighten the bone out and realign it. Okay, this will hurt like the dickens. You will never forget it. However, if you don't do that, then you will have so many problems down the line that you will never be able to reuse them. Yes, sir. There are various ways to put together traction, and it basically involves a certain type of wrap that goes, let's say for a leg or for an arm, a wrap that goes around, in this case, the wrist for an arm and the ankle, and you wrap it and then you tie it to, let's say, a tree or some support. Right, exactly. And so there's actually a way to do it, and you'll find information about that in our book and, of course, on our website. And of course, once you have the bone aligned, you need to splint and immobilize it in normal position. There are lots of different ways.